Developing to Scale. Technology and the Making of Global Health. By Heidi Morefield. Published by the University of Chicago Press. Introduction. The roads around Goma are bumpy. Extraordinarily so. The city lies nestled between the shores of Lake Kivu to the south and Mount Nyiragongo, an active volcano, to the north. It is the capital city of North Kivu Province, in the Eastern Democratic Republic of the Congo. When I was there in 2010 and 2011, the dried lava and rubble from the volcano's last major explosion in 2002 still covered many of the roads, making them impassable for most vehicles. Ordinary Congolese citizens could not afford the Toyota Land Cruisers that aid agencies proliferated around the region. On this particular day, I was on my way to Sake, which was 24 kilometers to the northwest of Goma. At the time, I worked as a project manager for a United States Agency for International Development (USAID) contractor, a private for-profit company that fulfilled the United States international development objectives on behalf of USAID, a government entity. Sake was one of 30 communities across North and South Kivu that hosted the USAID project I managed, aimed at bringing peace and stability to a region plagued by violence. Although it was only 24 kilometers away, it might take a resident of Sake all day to reach the hospital in Goma, given the condition of the roads. The residents of Sake had therefore proposed a grant to better equip the local health center, and I traveled there to assess the clinic's needs. The clinic director led me inside, where he pointed out that, aside from basic supplies and some new beds and mattresses, what they needed most were lights. It was very difficult to treat patients after the sun set at 6 p.m., but there was no electric grid, and widespread gasoline shortages from the ongoing conflict in the area meant that the generator sat useless, rusting outside. Solar panels were a popular, though costly solution, a good use of the grant money. Before I left, the director led me over to a corner of the clinic, where there was a refrigerator. It looked new. He told me that they'd had it for many months. It had been donated by a major humanitarian relief group to help preserve drugs and vaccines, but with no access to power, it had never worked. He shrugged and said wistfully that that was okay, really, because he'd never had any drugs or vaccines to put in it. Maybe with the solar panels, he suggested. I was struck by the stark discrepancy between the clinic's needs and what the staff had been given by aid agencies. Project
Sample complete. Ready to continue?